abdominal muscles and your thighs. So how often do you actually work out?
Every other day.
Okay. Is that associated, do you do that independently of your basketball practice? Because we know that you're a basketball player. Okay. Make a fist. I'm going to try to pry your fingers open. Okay. Now then, just lock your wrist. I'm pulling against that. And then now I want you to just really lock against that. Okay. Now then push against me. You can actually turn around and just push. Okay. Let's do the same thing for this side. Okay. Okay. Yep. Turn around and push against me. Okay. Now then, I'm going to kind of pull up, and I want you to push down against me if you can. Okay. Can you lift up on your thighs? Good. And push against. Okay. And we had already determined that. All right, I'm going to lower the bed and let you get down, and we're going to do a little range of motion and walking, and I'm going to look and see how steady your gait is, okay? Right now, more of the kind of drunk test that's really, you see it on TV all the time with these reality TV shows, but really is testing a portion of your brain just to make sure that your balance is there, okay? If you can, just put your feet together, and I want you to close your eyes, and I'm going to stand here pretty near. Are you feeling any dizziness or anything like that?
No.
Okay, you can open your eyes. Normally, just a little bit of swaying is normal, but we, you know, what we're looking for is if somebody has to jab their hands and feet out like that, that would be abnormal, okay? Well, I've got you up. Let's just do a little bit of range of motion. I want to make sure that you can move those shoulders. Lift them up as high as they can. Okay, put them back down. Now then, just kind of move your elbows a little bit. All right, can you swing your hips out like that? Any pain? No discomfort at all? What about the other side? You noticed any? Yeah, you might want to move away from the bed before you bop yourself. Okay, that's good. All right, while I've got you standing here, I want to look at your spinal cord alignment, okay, your spinal column there. I just want you to kind of turn, face this way, and I'm going to explain something to our students just so they understand, but you don't have to even absorb any of this, okay? On your checkoff sheets, there's something called the AP to lateral diameter. That ratio should be about 2 to 1. And what we're talking about, this measurement across should be roughly 2 times the measurement from what we call the AP measurement, okay? So this should be twice as big as this. It's a 2 to 1 ratio. That's what we expect as far as normal. With some breathing disorders, with COPD patients, what you'll see is this will even out. They get kind of barrel-chested, and so the diameter will be like a 1 to 1 ratio. This will equal this, and that's not normal, okay? While I've got you on the side, I'm going to kind of look at the curvature of your spine. You know, you've got 3 normal curves, your cervical and your thoracic and your lumbar, and yours is in the expected, the normal shape. I just want to look from behind. Okay, you've got just a little bit of a curve, but not much. Okay, I want you to just bend over and kind of touch your toes, and I'm looking to see if there's any asymmetry, and I think you're fine. Okay, let's stand up. I had made a note about the slight curvature in your spine. It's just a normal variation, probably as a result of just a slight difference in your leg length. But you've certainly, if you're not having back pain and you're not having any problems with it, just won't even address it. You can just go back and have a seat on the bed, and let me just one more time glance through and make sure that I didn't leave anything out. And I'm going to go ahead and record a couple of things here. Do you have any questions before we wrap things up?
Was there anything?
Everything looked absolutely great. Your vision is great. The only thing that I would stress to you is that you probably do need to go ahead and arrange for regular eye exams and regular dental exams, just so that things don't go way far bad. You're doing a lot of reading here in school, and so, you know, if you start having stinging, burning, you know, so you're having to really squint, I would go ahead and get your eyes checked, but your vision checked out absolutely normal in your 20/20, okay? All right, well, I'm finished. Do you have anything else to add?
Excellent.
Thank you,
done.
and we thank you so much.
Yes, we do. Now tell us when your first basketball game is.
I don't know when exactly the first game is, but the season starts in November.
Okay.
Okay.
I'll be looking forward to seeing you there, though.
All right.
Okay.
And which number should
14.
we be? Number 14.
Number 14, we
Number
can remember
14.
this.
Well, do you mind if I conference with her for just a minute
No,
here? Alyssa, this was an excellent job.
Well, thank
you
you.
so much for doing this. As you can see, that I always make multiple notes on the physical assessment performance evaluation that's filled out by everyone. Doesn't mean that anything is wrong with it. It's just your tool after I finish with it to give to you. And I can tell you, you absolutely did a beautiful job and really didn't miss any areas at all. I only have a couple of suggestions
Okay.
for improvement. On the area of, and maybe a few questions to
Okay.
clarify. In the area of, did an excellent job with palpation for PMI. Did you compare and contrast the apical
did
radial
not.
pulse rate?
I did not.
So that's okay, no problem there. You did such a wonderful job in the other areas that I really felt like there wasn't any need to readdress that.
Okay.
In the hospital setting, as we're palpating for the PMI, though, you know that it's probably best to go ahead and compare apical to radial rates to notice any disparity. Because what happens is usually whatever we put out at the apex of the heart perfuses to the radius simultaneously. In some disease states, and it may be cardiac in origin or otherwise, for example, in a condition called thyrotoxicosis or Graves' disease, that sometimes there's disparity there and somebody can get a cardiac abnormality, meaning that the apical rate puts out a lot more beats than the radius is perfused to, and we get what we call a pulse deficit.
There you go.
All right. So in his case, of course, we didn't have that problem, but it's just something that we would want to attend to. You didn't ask him specifically about the 3 magic questions that
Yes.
we always address with level of consciousness. However, I don't think there's any question with me. We'll just ask him those magic
Just
questions
for
right
hints, you know.
now to add it into your
Okay.
dialogue.
Okay.
Would you mind telling us your initials? We're going to do
Yeah,
that.
we'll just do
So,
initials. We'll
unless
worry
you
about
want to
that
do your
one.
full name
He
for
said
the
it was
tape.
okay.
My initials are ALT.
Okay.
ALT. And could you tell me what year this is?
This is 2003.
All right. And could you tell me what place you're in?
I'm at Angelina College in activity.
In health careers
Health
1, but
careers.
you don't have to be
No,
that
I'm going to ding him on that one. I don't know.
I think
well,
he's,
you're all
I
right.
think he's A-okay. You want to tell me the state and the place? We're in Lufkin Land?
Lufkin, Texas.
And you're all the way from?
Memphis, Tennessee.
All right. How about that? Okay. So those are our 3 silly questions that we ask our patient. Sometimes we have to check in with ourselves to make sure we're oriented to time, place, and person.
There you
too.
go.
Alyssa, I believe that you have, out of the possible 75 points here, 74 of those.
Ooh,
And
okay.
because I only took away one measly
Well, there
little
you
point.
go.
And
Okay.
if you do well on your write-up, you will have a 99.
That would be great.
Wouldn't that be wonderful to
Okay.
average in with RNSG 1215? Now,
Okay.
another study tool that our students are using that we want to refer to them in our syllabus is RNSG 1215. It is their last unit and it is an integrated adult physical assessment guide. And it looks at every system, the procedure, the usual findings in every system, and some comments and variations that we might see in a less
Healthy.
healthy and
Subject.
a little bit older.
Yes.
You know, as we start to age, some things start to change a bit. And so those variations are there. We're also in the process of preparing pediatric variations. So a column is being added to our health assessment class here. So I believe we're just going to show a slight female variation,
Okay.
and then we're done for today.
I think so.
Thank you.
Hi, I'm Elisa Bass, and I just wanted to demonstrate to our students a few variations that that are factors in examining the female body. What was your name?
Samantha.
Okay,
Yep.
all right. The first thing that you're going to notice about Samantha is that, you're going to stand up just for a second, and I want to demonstrate to them what we've got going on here. Just kind of turn sideways. We've actually got 2 gowns on her, and that really kind of helps when you're doing the peer assessments, because this bottom gown opens up in the front. They can tie that, and it covers the breast. The one on the top is going to open in the back. That when we lay her down, we can just lift up this part and still get to everything we need to without totally exposing her. We can use the bottom gown kind of as a veil against the breast, and this top one is going to totally obstruct the view and retain her modesty and all of that. Okay?
That concludes the physical assessment portion of your peer assessment, which is worth 75 points of your total grade. Your instructor will use the evaluation criteria that is included in your RNSG 1215 syllabus, starting on page 28, to grade the physical assessment portion of the assessment. Following that, you will be asked to go to another room and complete the documentation for the peer assessment, which counts for another 25 points of the total grade. Again, the top page should have already been filled out by your patient. The remaining portion will be filled out by you, documenting what your findings were from your physical exam. Keep in mind that you will have no assistive aids. There will be no books available for you during the documentation portion of it, so you should be familiar enough with the terminology that you can document this without any assistance. On page 31 of your RNSG 1215 syllabus, there is an evaluation form that we use as a guide to grading the documentation portion of your peer assessment. You might want to read over that and see if it is helpful to you as you prepare for this. There is one other portion of the RNSG 1215 syllabus that you do need to become familiar with early on. Hopefully you've been using this all along. It's called the Integrated Adult Physical Assessment Guide. It's very helpful. It has normal findings, how you would document that, and it has some abnormal variations and how you would document that. This will not be available for your use during the documentation portion of your peer assessment, but it is a helpful tool that you can use not only this semester but throughout your nursing education. I hope that the video has been helpful in preparing you for your peer assessment, and I hope that all the skills that you have learned in the 1215 course will help you in your nursing career. Thank you.